But like anything, it's important that you compare apples with apples. So, for example, you may see an advert that has a very low price for implants, and some of the things that I would say to patients they need to make sure of is, does that include the cost of the x-rays, also the crown that needs to go on top of the implant. Sometimes, depending on treatment, you may need to have a temporary crown done, and also bone augmentation. So I think when you weigh up all of those factors, you may find that some of the prices being advertised are perhaps a little bit different than you might first think. So most patients are aware of the normal radiographs or x-rays that they have taken in the in a normal dental practice, and those radiographs are really useful, but they're really only two-dimensional. So in terms of implants, if you take an X-ray, a normal X-ray, in order to plan for an implant, that X-ray is just one snapshot of the level of bone in the jaw. The big advantage with the CT scan is that it takes literally hundreds of sections, and the software patches all that together, so that as an implantologist, you can actually look and see the depth throughout the bone, and that makes a massive difference. So that's something that I'm asked quite a lot. Are all implant systems the same? And I think the answer has to be no. And there's a few different reasons. So one thing is that the grade of titanium that is used in the implant is really important. So studies have shown that the best integration, you need to use grade 4 titanium, and the system that we use does have that. So there's very little impurity and in terms of the alloy that could be with the titanium. Is that with some systems you don't get the same amount of options to restore on top of the implants. So the system we use has got a wide variety of restoring options, and that just means that we can offer the best choice to patients, and it's very much a tailor-made solution for each individual. So we use a technology called PRGF, and that stands for plasma-rich growth factors. And so one of the advantages of that is that you're using something that comes from you, so it's totally natural. It's not something synthetic or that's been made in any other way. And what we found is that really does improve the speed of healing and integration of the implants. And so, in fact, it's quite a famous product now because a lot of sort of top-ranking sports stars use it. So, for example, in the world of tennis, Rafa Nadal has used PRGF. In football, people like Lionel Messi, and even in golf, people like Tiger Woods. So it's one of those technologies that I think is going to become more and more prevalent as time goes on. But still in the UK, very few dentists actually use it when they place implants. So we really feel that's something that really differentiates us from other clinics.